Hi, good afternoon. I wish it's the first time that I got in front of a group after we had our most deadliest act of gun violence in the United States. But sadly, I've done this more than once. It's a really hard day for me and probably all of you, thinking about what happened in Las Vegas. It can be very traumatizing, demoralizing, can make us feel that it's all pointless, right? It's too hard. But I think the reason I've been doing this for over 25 years, and many of you I know have been devoting a good portion of your lives, is that you know that it isn't pointless, that there are things that we can do. Whether we're talking about historic rates of gun violence in Baltimore City, or the tragic kind of mass shootings that we're seeing now, I believe that that evidence, as well as passion, can move us forward to solutions, and the public health has a lot to contribute to that. I'm so pleased today that we have with us one of the national experts studying gun violence and studying very important strategies that we've used here in Baltimore and have been used in many cities around the country. Dr. Katerina Roman is an associate professor at Temple University in criminology. She got her PhD in sociology, justice, law, and society from American University. For many years, she was based at the Urban Institute doing fantastic research there on juvenile justice issues, youth violence. More recently, she's been at Temple doing outstanding work. She studies relationship between neighborhood characteristics, fear, violence, and health. She also studies social networks of high-risk and gang-involved youth and evaluation of innovative violence reduction programs, including the program she's going to discuss with us today. Very timely talk by a real expert, and again, I'm so grateful, Katerina, for you to join us today.
Thank you, Daniel, and thank everybody for coming. It's a tough day, but I truly believe that violence is preventable. I spent a lot of time when I was at the Urban Institute going to different communities around the country, evaluating programs and looking at different communities and the nature of high-risk youth and the different constellations of characteristics in those communities. And I really felt like I learned not only what works, but what could work and what doesn't work and why. And that's really led me to bring together my research areas to focus on a few key interventions. And these are the interventions for the high-end youth and young adults. And I've been very lucky in my time at Urban and Temple to be very involved with the Cure Violence public health model to reduce gun violence. And I was the individual who went out to visit Dr. Slutkin in Chicago when they were just a year or two into their initiative, and the Department of Justice wanted someone to see, can this program initiative be evaluated? So I did the first evaluability assessment, and I was blown away by the possibilities of the model. And at the same time, I was doing work in DC with Commissioner Charles Ramsey, and they needed a research team to start to think about their gun and gang violence problem. And I got involved with a Project Safe Neighborhoods grant, which comes through the U.S. Attorney's Office. And so at least for the last 10 or 15 years, I've been closely involved in researching and studying both the focused deterrence David Kennedy model, which is currently called the Gun Violence Initiative or the Gun Violence Reduction Initiative. I will refer to it as focused deterrence, and then the Cure Violence model in Chicago. So what I want to do today is give you a look at the complementary nature of the models. What a lot of people don't think about is the core mechanism for change. And the similarities there, pulling out the similarities, I think are really important for understanding how communities can work together to withstand violence and change the norm. So I'm going to talk about that, show you the differences, and then talk about what I think, having looked at these models in Philadelphia, DC, and other places, the strengths and weaknesses of the models, and then the research evidence. How do we look at that and say, how do we think about thumbs up, thumbs down? And if we were a community, there's so much to go through. There's so much evidence promising innovation, all these buzzwords. How do we sort that out and think about, if we're a community, how do we make our priorities here? And it's very different community by community. It's not just what the nature of need is. It has to do with the political landscape, the general socio and economic landscape of neighborhoods, how different nonprofits work together. So I'll talk about that, and then what we found in Philadelphia with regard to the evaluation. So we have cure violence. Is the key idea is treat violence like a disease. Violence is preventable. This is Dr. Gary Slutkin, an epidemiologist in Chicago, who was the one to come together with a team of researchers and say, we could apply this model of targeting where the problem is, making sure we're selecting the most high risk and putting everything towards a change in behavior. This is David Kennedy, whose book was very well received. If you're interested in this model and you're not fully familiar with it, I would highly recommend the book. It's written as if he were a journalist. He was a writer before, and a historian, essentially, before he does not have a degree in criminology. A very accessible book. And the core ideals behind this model is deterrence, and I'll talk about that. He also believes that the mechanism of deterrence can create a norm change, and I'll show you that in a second. Here's a little bit more about the background of the models. Cure Violence started in 1999 at the University of Illinois School of Public Health. On the ground, Cure Violence in Chicago is called Ceasefire. In Philadelphia, when we get to that, in Philadelphia it's also called Ceasefire. We want to stop the spread of violence with this model. And as I mentioned, you target the high risk, and there are very specific eligibility criteria that staff go out and seek to recruit individuals that meet this criteria. It's 7 criteria: having been in prison, member of a gang, high street activity, victimization, could be on probation or a parole. And you have to meet, I think, 5 of the 7, and you also have to live in the target neighborhood. And then the outreach workers and violence interrupters work to mediate conflicts. I'll talk a little bit more about that, and overall that results in norm change. The first independent evaluation, so not a part of the team, Wes Scogan at Northwestern, not a part of Cure Violence, came in and said, we'll evaluate this with funding from the Department of Justice. Overall, the findings were mixed. Some neighborhoods saw positive results, some didn't. I'll talk more about that as well. But both these models are extremely popular in the U.S. Cure Violence is in about 25 cities, probably more over time, the ones that stopped and started. It's probably at least 40 or 50, I would guess now, U.S. cities, 8 countries, 5 continents. Focused deterrence, or the Gun Violence Reduction Initiative, started in the 90s, known as Operation Ceasefire. I won't use the term Operation Ceasefire because it is confusing. I'm calling this focused deterrence. The main components are go in and map the landscape of gangs. You must use data. You need a research partner. You figure out who the most motivated offenders are and have been with gun violence. You bring them together in a room in a formal setting. It can be informal, and you use law enforcement leaders to deliver a deterrence message. There was an evaluation by the researchers who were partnering with the law enforcement in Boston, and they found a whopping, this is a huge effect for criminal justice initiatives and programs, a 63% reduction in youth homicide. And as I mentioned, very popular, currently in around 80 cities and towns, and it is expanded worldwide as well. So this is what your theory of change, the overall logic model, looks like when I sort of bring it down to a few key components. These are the similarities. You have the main idea is that you are looking for community level outcomes. So over here, these are both programs. Even though they're seeking to do some work with individuals, you are measuring the outcome at the community level. You are looking for aggregate level overall reductions in shootings or violence, aggravated assault, firearm homicides. And when you look at the activities, these generally stand for both strategies. Identify the high risk and group involved individuals. You want to interrupt the conflicts. The Cure Violence model does this in a more hands-on way. I'll talk about that in a second. But you need the community. You need community partnerships. And it's a little bit different, so we'll talk about the differences here. But together, you're targeting individuals to avoid situations that involve the risk of violence because you want gun violence to decline and you want to change the norms about violence. When you broaden your logic model, you have a component of behavior change. As I mentioned, you are working with individuals, but you're not necessarily looking in your evaluation to see, did those particular individuals change? It's the overall reduction in violence. But there is an individual level component here to achieve your community level outcome. I want to stress that a lot because this is where we often fall off in evaluation and understanding what works in the initiative, and I'll come back to that. Then you have your norm change, the community outreach, exposure to anti-gun violence messaging. This is done different ways in the two initiatives, but generally, again, under the same umbrella. Coordination with key partners, faith-based, of course, and other community groups. So you're assuming that these individuals then will avoid situations involving violence. High-risk youth apply non-violent approaches. It's a learning. It's a behavior change in learning new ways to solve conflicts. The community disapproves of acts of gun violence and needs to reinforce the message. Again, community actively involved here. But this is where your strategies separate in terms of their activities here. This is Cure Violence. So you have outreach workers who are returning prisoners, ex-prisoners, individuals who have lengthy felony convictions and sometimes long stays in jails. One of our outreach workers in Philadelphia was incarcerated for 18 years and then had been out for a couple years looking to get involved in gun violence initiatives. But this is often typical across sites across the country. So it's direct case management with high-risk individuals. So each outreach individual, each outreach worker would work with 15 at most individuals on their caseload, almost daily connection, at least daily texts, once a week, home visits, sometimes more. Sometimes that falls off, but the idea is a 24/7 case manager that can support you in all of your needs and refer you to the appropriate services. You're driving the individual to places, you're going to court with them, you're making sure that services might be available in the community, so you're working with your program director to say, these are the greatest areas of need. The violence interrupters, I know some of you know this already, are especially devoted to trying to determine where brewing conflicts might escalate. And they are working to stop the violence as it's occurring. And they're very, very active in stopping the retaliations. So that's an easy one to visualize. The two groups are involved in a shooting, and one of the individuals is hurt from one of the gangs, and the violence interrupter works with the outreach worker then to go to the other gang and say, let's think about the options here and not go right to the gun. There's a very strong public messaging campaign that involves vigils after the shooting and letting the community know what happened, and doing marches and walks and holding events. This is a bit different than focused deterrence, but the message about being there in the community when an event happens is very much a part of the Cure Violence strategy here. And then we have the same intermediate outcomes. This was the same as the slide before. So this is focused deterrence, looking at the specific activities here. Once you've identified who the gang members are, this is all law enforcement driven. You are working with a research partner, but you have many different agencies across the spectrum of the justice agencies, and some cities believe it's very important to have federal agencies involved as well, so you have the threat of federal prosecution for particular cases. Philadelphia did not use that lever because the attorney's office in Philadelphia was not prioritizing violence under the last 4 years of the U.S. attorney there. So that wasn't a piece, but you'll see that we still had some successes with focused deterrence. But the law enforcement partnership, getting together to work together to share intelligence, to make sure you're targeting the right individuals who are then brought into a room and you say to these individuals, you must put the gun down, the shooting must stop, or we're going to come after you with every lever. The strategy is also called pulling levers. Every lever possible, every legal mechanism that exists. And they're legal mechanisms, there's civil aspects of what happens. Nothing is outside of the legal system. It's just that, as we know, in communities that have limited resources, we're not often focusing everything we can on some of these cases. But for focused deterrence, you are weekly meeting with key individuals to talk about what is going on with this gang, this individual. Is there a warrant that we have not served yet? Does this individual have an open child support case? Do we need to bring him back in to talk with him again? So in Philadelphia, we've used public utilities shutting off electricity that has been turned on illegally. And then you have the head of the household, the mom or the grandmother, say, hey, Katerina, my electricity just went out. What happened? What are you involved in? And there's some type of pressure there. And Philadelphia has been very successful with turning off electricity. There's been dozens of cases where this happened, and there's been a response from the community that this could be working, and these things that you wouldn't normally think of, but bringing it together for the cases have been very helpful. Custom notification, not every community does this. Philadelphia has not used custom notification. Usually you're at what's called the call-in, these group meetings where those individuals who've been identified are together and you deliver this message. But there are influentials, group members that are very popular, that might have been doing a lot of the shooting in the past, that you can get community leaders to come in with a law enforcement member to go to the house and say, hey, you're on our watch list, but we do care about you. We're not just here to put you away because you may have done something wrong or may do it in the future. We're also willing to offer you social services if you change your behavior. So there is a social service component with and I wrote here, some services offered. Every city does that differently. In Philadelphia, we had one case manager who had 50 or 60 individuals over a 2-year period on the caseload, but it was just one person, and it often was focused on a couple particular gangs that he was very strong working with. In my mind, it wasn't enough of what's needed, but we can come back to that if you're interested in the service side. But together, you're doing this message, either individually or in a group, to then put the law enforcement pressure on those potential offenders and possible offenders who might be shooting. And then you're reaching, hopefully, you're reaching the same outcomes here. One of the things we'll talk about when I get into the evaluation in Philadelphia is we don't really know a lot about the mechanism of change here. Is it the pressure and the message, and there's police presence after a shooting, something's different going on that's creating reductions in violence? Or is it the crackdowns and enforcements that are removing more of the high-risk targets from the street? So this is a key piece here that happens that does not happen in the cure violence model. Again, the deterrence component. So our strengths. So for cure violence, it's aimed specifically to prevent violence by changing norms, attacking that code of the street, promoting pro-social roles and behaviors. These, the ex-prisoners, the ex-gang members, the individuals are working to model new behavior. Hey, if I can do this, you can do this. And to do the conflict mediations that are needed. Long-term change is possible because you're working directly with behavior and attitudes. It is sustainable with staff upkeep. Focused deterrence, as I mentioned, more about deterrence and incapacitation. You get quick wins, and we've seen this from some of the evaluation literature. And a lot of that may come from, but we don't know, from removing individuals from the street. Does provide alternatives because social services are available. Partnerships for cure violence. The interesting thing here, it does not rely in any way on law enforcement. It can totally happen without any law enforcement partner involved at all, but the model does say it's important to have law enforcement partners so you can be getting data on shootings, so your outreach workers can know what's going on. You could be mapping incidents and working together. And you want law enforcement to know who your outreach workers are to make sure that there's a separation. And again, for those of you interested in that, we can talk more about that. The partnerships, the neat thing here with cure violence is that if you're interested in prisoner reentry and supporting reentry, cure violence could do that well. You could be doing in-reach to prisons and creating a more seamless targeting of high-risk youth that are coming back, because you have the staff who's often knowledgeable that some of their older buddies, other buddies, or younger family members of friends are coming home. There's a lot of training, but both, I should have training here for both of them. But the National Office of Cure Violence actually has a database that they'll give you for free and train you on and on how to keep data. And they'll come out and do trainings and booster trainings multiple times a year. Staffing, you're hiring individuals from the community. Use of peers, there's a lot of support in the literature for using peers in staffing. You've got violence interrupters, so you're really targeting the need in communities here. You're giving jobs, as I mentioned, to these individuals. Not too costly here. If you think about a neighborhood, 10 by 15 block neighborhood, 250, 300,000, yes, that is costly, but in the larger scheme of some comprehensive initiatives that are out there, you could do a small hotspot neighborhood with 2 or 3 outreach workers and a violence interrupter. Focused deterrence, again, I mentioned you have the instant wins from this. You need committed law enforcement partners, enhanced collaboration, help maximize the intelligence that's being shared. These are strengths because you're creating new knowledge and you're creating a seamless model for partnering that often helps overcome past turf issues here. The less indiscriminate law enforcement techniques can actually enhance perceptions of legitimacy, and this has been a very important concept that David Kennedy and his colleagues have been discussing very much more in the last 5 or 6 years with all the issues with race and injustice and in our communities and with policing, talking about how this model can actually enhance, if you're doing it right, it can enhance community perceptions of law enforcement. There hasn't been a study, there's no evidence yet of that. I think there's researchers working on that. The neat thing about the staffing is in Philadelphia, the only funding that was needed was to fund the social service worker, the case manager that I mentioned. Everything was just rejiggering staffing to meet the need to do these meetings and to share this intelligence and bring the group together. So it can be done with minimal costs. Weaknesses, and this will come clear as I talk through the evaluation literature next. We're not clear how long it takes to change norms. Both of these unknown mechanisms, we don't really know how we get from the left side of our logic model to the right side. We can theorize about it, but no researcher, no study has been able to capture the activities and look at the activities for each model and if they're needed and what is creating that reduction in violence. And a lot of it has to do with how difficult it is to do evaluations. That's not a criticism of the studies that are out there. It's very difficult to evaluate these well, but you should have some skepticism when you're thinking about what these models are doing and how they work. Depending on how the program was initiated, community may see Cure Violence as an outsider. Philadelphia used Temple University as the fiscal agent, and they at first had Cure Violence Temple shirts on, and the community was like, we're not talking to you, right? So it really matters how you're implementing your core program here. Potential law enforcement officers may not approve of the use of ex-offenders. There's a way to get over this. I won't get into this. Hiring, as we all know, high-risk individuals presents many, many challenges, and lots of communities have dealt with a lot of issues that have taken a lot of time and resources. Funding, as I mentioned, $350,000. It might not seem, I mean, it's a lot of money. It's less money than some of these other comprehensive programs, but it's not in our resource-constrained communities. It's often very difficult to sustain. I mentioned the theory of change. Partnerships. A lot of weaknesses here are the turf issues. You need a transformational leader. You need to be thinking about who is managing the partners and who is working together to say, hey, if the police aren't doing what they said they would do after the shooting, but probation was all in, then someone's feelings are going to be hurt, and someone needs to be managing that and figuring out a way to talk about it, to move past it. This is an issue we've dealt with here in Philadelphia. Public Defender's Office keeps saying to us, you have a gang list. You have a gang list. That's not fair. They're getting penalized because they're on the list. You haven't told us why they're on the list. Well, when I was working with the program, we were telling them why they're on the list. Philadelphia has a very transparent, you're on the gang list or you're in a gang if X. But it's the communication you have to have with all the different agencies. High staff turnover happens because our best leaders who are running the program when it's working then get promoted. This is a big issue, and we've seen this in Philly, a big issue. Intensive human resources, partners constantly pulling the levers. Philadelphia only chose to do it in one area of the city, which I'll show you, and they've basically been saying for 2 years now, we don't have the time or the resources to expand it. We think it'll fit best in South Philly. We're not going to expand it. So a lot to think about. So I'm going to spend time talking about Philly, so I'm going to quickly go over Cure Violence, the evaluation findings. If you sort of look down here and you see original Chicago study, first one in New York City, Brooklyn, Save Our Streets, and then our very own Daniel Webster here in Baltimore. The neighborhoods that were implemented the strongest saw a significant reduction in shootings and homicide, so we have promising here. I put the mixed signal here because it's not overwhelmingly positive. we did have positive results. We, meaning Chicago, just in general, the nation saw positive results with Chicago, an iteration in 4 police beats in 2 neighborhoods. Later on, there's been neighborhoods that have stopped, started, been dead for 2 years, and then something starts up again. New funding. Funding comes in Chicago from the state, also comes from the city level. There might be outside funding. So there was a bunch of positive findings here for this evaluation. Phoenix Truce, still not sure. Phoenix, and those in Phoenix and the researchers say it was implemented with fidelity. Cure Violence National Office says not necessarily a good site, but they actually saw shootings increased in the target area. But that's just on average. Today, a report from John Jay College of Criminal Justice just went live on 2 evaluations that were conducted in 2 sites in New York City that actually saw positive, strong, positive reductions in gun violence, both from hospital admissions data and from shootings from the police department, and coupled that with attitudinal change, reductions in attitudes that support the use of guns and violence. So there's new hot off the press today that New York, 2 of the sites in New York are strong. But when you look at focused deterrence, the literature on average supports the success, that the focused deterrence is working. And I won't, again, spend a lot of time on this, but there were 2 studies done that take all the studies that are out there, bring them together, and synthesizes the results of that study in a very rigorous way to say, on average, do we see a strong effect with focused deterrence? And that first study was published in 2012, and 10 studies were analyzed based on very specific inclusionary criteria. Focused deterrence can also do drug markets and try to reduce drug violence created from drug markets. So it's not just gangs and group studies, but 6 of the 10 studies reviewed evaluated strategies aimed at gangs. And almost all of them, 9 of the 10 studies showed statistically significant reductions in violence. So we've got positive results there. The the update to this meta-analysis, 24 studies analyzed based on very similar criteria. Of the 24, 12 were focused on gun violence and gangs. And all 12, that's all you need to take from the slides, all 12 of 12 studies, some were in that earlier study and some were new since the first study had been published, found that there were reductions in violence. But it's also important to note that the authors have a big section in the report, and kudos to them, that as the rigor of the evaluation got stronger, the effect size decreased. So if you were to take out the ones where you couldn't totally be certain that the study methods and the techniques and there was strong validity to say, I can conclude with certainty that the reductions found were due to the strategy, if you take those out, it would almost halve the effect size. So that's important, again, to think about in how much we need strong evaluations there. I want to just quickly mention that 2 studies, they were both included in the updated meta-analysis. 2 studies actually said we have to do more than just look at the community level effect. We need to look at whether the gangs targeted reduced their shooting behavior, not just did the overall community see a reduction in violence. And both of these studies found that the gangs that were targeted reduced their shootings. The thing to remember here, which I'll get to, is in Philadelphia, we did not find a gang level effect, and I'll talk about that. So it gets complicated again when you're trying to sift through the literature, but think about 24 studies on focused deterrence. Only 2 looked at if the actual gangs and groups targeted reduced their behavior. So who's reducing shootings? Yes, I mean, in the big scheme of things, it's great that violence still went down, but is the mechanism of change, is the hypothetic model what's actually working here as it's been articulated. Just something to think about. So Philadelphia, here's Philadelphia. And North Philly, this is North Philly, doesn't really look like North. The temple sits right here on the east side of the target area for PSAs, police service areas. We don't have beats, we have police service areas that make up a larger district, and there was a hotspot of crime up here in another police district that ceasefire included in targeting. Focused deterrence is in a larger area in South Philly. North Philadelphia here, in the entire city of Philadelphia has the highest rate of deep poverty of any city in the country, any of the top 10 large cities, and it's almost all right here in North Philly. This was a big shoe to fill here in terms of doing something. Both were started at the same time. So, and it just so happened that, and the efforts came about very differently to do the evaluation. I helped write the grant for Cure Violence, so they put money in the grant for the evaluation. So I am involved in the implementation, so non-independent research. So take that when you're thinking of me going through the results. I was involved in not really helping them implement, but with the group as they were implementing it and studying it and evaluating it. Here, focused deterrence was homegrown, no money, they didn't use PSN money. There were a number of individuals that read the David Kennedy book and said, hey, we could do this here. And then they brought me in because I had experience in DC, and we started talking. Things got underway. A team of 20 went to training in New York City through the David Kennedy 2-day training, and it got started. And then I wrote a research grant to do a larger evaluation for this. So what you need to remember here is the evaluation timeline is the same. You have to look at the details because I want to get to the results. The treatment period examined, it's just a pure coincidence that the first call-in for focused deterrence was April 2013, and the outreach workers for Cure Violence, or this was focused deterrence, the outreach workers were fully trained in March and April and started to have a caseload in April. So the implementation period is similar. What did we do? We created matched comparison groups as opposed to just saying these are the other neighborhoods that had the next highest crime that we should match for South Philly and North Philly, and we did it separately. And so there are little different models going here, but you just know that these are statistically matched neighborhoods that form the comparison groups. And we used a lot of data. We had data on how many probationers, probationees, and parolees were in the neighborhood, so we could look at that. We matched on number of gangs, size of gangs, so we very carefully tried to match communities, because the one thing we heard, and you always hear in evaluation, is you'll never find a comparison community. And we spent a lot of time on that. Okay, and then in focused deterrence, I mentioned we also looked at gang impacts. These are our little gang set spaces here for the number of gangs. 14 gangs were targeted with the call-in, and then many of those had crackdowns. So we have this other aspect of the evaluation for focused deterrence. And here's your big picture of what happened in Philadelphia. Cure Violence in the subset of target areas, that we had all of this one large police district, but the majority of work was done in these hot spots of violence in the northern area. And I'll talk about how we did the evaluation. But in the area where the outreach workers did all of their work and were mostly focusing, we saw a significant reduction in shootings that was the equivalent of 30% reduction in shootings in the 2-year period after the implementation. Focused deterrence in South Philly, 35%. So we're not saying whether these two are statistically significant from each other. The change with regard to the change in the match comparison group, the difference in difference for those of you in school and studying public health and interventions, we did a difference in difference model, and the change was significant over and above the matched comparison community. This is what the graphic looks like that we did for the 14 gangs that were targeted via the call-in, sending the message. You had to have at least two, I think in our case, it was 2 gang members attend a call-in, 14 gangs. Up here, these 3 here had an increase in gang-perpetrated shootings after they were called in. 2 had negligible change, and the remainder actually saw decreases in the average quarterly change. This is all good. And if you're running this initiative, the partners are very happy about this. But from a rigorous statistical research point of view, taken together on average, even though there was this larger number of gangs seeing a reduction, the pre-post change was not statistically significant. So we cannot conclude with certainty that this change was due to the intervention. And that's where we've left it. Just want to quickly mention this and then get into the pros and cons so we have time for question and answers. There were 1, 2, 3, 4, 5 hotspots of gun violence. This is the whole target area here in red. When I said the northern area saw change, we also looked at the change in these hotspots here, just here, with matched hotspots, and we also saw a reduction in violence, 34% significant. When we took this whole area, which these little purple triangles are where the individuals did the staff did their mediations. You can see not many down here at all. Some sort of go around with these gangs. There's gangs in these areas. When we looked at 73,000 people here, when we took this whole area, we did not see a significant reduction in crime. It was concentrated where the outreach workers and the staff did most of their work. Okay, so we have community level effects for both strategies in Philadelphia, but for targeted gangs, for focused deterrence, no significant reductions in shootings. So how would you choose a model? You're a community. This is the way I tend to think about it, knowing the strengths and weaknesses and the pros and cons, having been in it. You're a community and you need a quick win. I'm going to say you got to be, and you have law enforcement on board, you want to be thinking about the law. If you're thinking about the law enforcement side, and policing is big here, you've got focused deterrence. You want to capitalize on the good intelligence that these partners have. Philadelphia wanted to do that with South. They knew the officers and the district attorney's office always worked together very well in South Philly. The neighborhood was ripe to have focused deterrence. Do you want sustainable changes to the code of the street? Do you want to be working from the community level up in changing norms? You're going to be leaning towards, in my opinion, cure violence. Holistic support, new opportunities for youth where you're making the opportunities, you're modeling those opportunities, you're mentoring the individuals, cure violence. You can do some of it in focused deterrence if you put more effort on the services. Do you believe in the power of relationships, peer role models, powerful change, learning from learning? You want cure violence. So I'm not saying I'm going to conclude that cure violence is the better model, but you would be thinking about the models from where is the change occurring? Where do you want to end up? How do you think about sustainability? And then you really you don't have to choose. The problem has been, as an outsider looking at the work of Gary Slutkin and the work of David Kennedy, it just seems like they're competing. The initiatives are competing, and no one wants to bring them together. You could actually bring them together, and we've spent a long time in Philadelphia talking about how to do this, and it might actually happen in Northwest Philadelphia. And there's a way to do it, but you'd have to really have individuals there thinking about how do you separate. You don't want the outreach workers clearly to be talking to law enforcement. That's the biggest risk there, but you can do it with careful contemplation. Okay, and then a few obstacles to think about, lessons learned. Sustainable funding is always an issue. In cure violence, it's even a more serious issue because the outreach workers get funded, then city council decides something, or there's a freeze on funding, and then they lose their jobs. And they get another job. Are they going to come back? What do you do with their 15 kids on their caseload? They've been depending on this individual that it can be really harmful. There are some really big issues here with funding that you don't always think about unless you're in it. You have to have a manageable service area, target area size. You need a storefront. You want a visible presence in the community. Philadelphia did not have that, and it was a big detriment. I think we would have seen a larger effect. We have the issues with staff sometimes. Data collection needs are astounding and being able to support the data has to be input almost every day by the staff. Relationships between the staff and law enforcement has been a problem in Chicago and other cities, where we've heard stories where law enforcement officers were purposely sidling up to outreach workers in front of community members to look like they were getting information from the outreach workers. So there can be issues. You have to be very careful with both strategies. With focused deterrence, I would say from my perspective, the biggest lessons learned are a lot of initiatives say we're going to be proactive. We're going to set our implementation plan, and when a gang shoots, we're going to focus on them and we're going to sustain our focus on them. But then there's some shooting of a child outside of a school that's not necessarily been a focused deterrence targeted gangs, and everyone stands up and says we need all of our resources on this shooting, and has nothing to do with focused deterrence, and you can lose focus, and that often happens. You need buy-in from all the agencies at the same time and the right level of staff. We know how difficult that could be. Balancing the enforcement and social services. Philadelphia enforcement came first, and it seemed like social services was slow to pick up. As it got into the thick of things, I think we had stronger effects in there. But and again, the resource needs for the individuals that we're talking about are just so extraordinary. I'm going to skip this so we have plenty of time because it may come up in the question and answer. But again, my thoughts here were about how difficult it is to understand what is working within these models, and that we can't just say, hey, this has worked, let's do it, right? If you're working with a team of people to implement these initiatives, you want to have some staff that can read through the lines and sift through and understand the strengths and weaknesses and how evaluation could work. And of course, as an evaluator, I'm going to say couple evaluation with strategy, implementation. But in these cases, and because there's a lot of guidance now, just starting to see some publications on where research should go next and how evaluations should work. The group in New York City at John Jay has assembled a large advisory team. Daniel's on it, I'm on it, and everyone's thinking together about how to make the evaluation stronger. Those are really smart ways of thinking. And again, that's just more of the same about we really have to understand the mechanism for change and think deeply about it. Thank you.
Thank you. That was a great presentation. I don't think it is. Oh, there we go. Okay. I'm an alumni of Temple University, so thanks for coming down here to see us. Do you have any sense, it sounds like the general rate of violence decreased, I just want to make sure I have it right, but in the gangs it wasn't significant. So do you have any sense of what else was happening? What was the context? And did you see, I don't know if they evaluated them, but were those reductions in domestic violence?
So this is an excellent question, and we have spent some time thinking about this because the city, the deputy managing director wants to know, hey, if we're going to expand this, did it really work, or was it just law enforcement on the street? And I do believe that our findings indicate that the police presence and the law enforcement presence on the street when a shooting occurred really helped tamp down on anything else that might be going on. The younger gang wannabes that weren't on the gang list and other potential offenders, kids that are not necessarily on the radar yet, or seeing that something's going on. And I think that was keeping overall violence down. And some other studies have shown that there is a diffusion effect, that there's something going on. Some may advocate for or say that that's the deterrence message getting across to everyone, and the norms are changing. Is that norm change? I don't know. I'm always skeptical about this larger norm change, but the deterrence message, the general deterrence message, I do believe is working. But then there's the other point, well, then why are we not seeing a greater reduction in the targeted gangs? And in discussing this in detail with some of the gang task force officers, they indicated that a couple of the gangs that were most active before were extremely large and not organized, and would not necessarily pass the message on or care about the message. So in their disorganization as a large gang, there are multiple factions in them, and maybe focused deterrence didn't target the right members of each of the factions, and the factions were splitting off and wanting to say, hey, I got this turf, and show their weight, so they were ignoring the message. So this less organized structure, you did not have the gang leaders saying, hey, to the others, we better put the guns down. The other piece of that is juveniles were not called in. And some of these, the two big gangs that were very active, had juveniles splitting off, and they wouldn't have received the direct message.
I'd like my turn now. First, thank you. This is really very, very helpful. And I want to see if you want to go any further on the last comment as it relates to the changing structure of gangs. You mentioned a couple of things that I think are relevant that certainly I hear in Baltimore as well. One is sort of a fracturing, of less cohesive gangs than perhaps was the case initial or years ago when both of these models were developed. And then also the juvenile component to this as well. It seems to me that when I've talked to individuals doing either of these models, in some ways they have benefited from a larger, more cohesive gang structure to get messages across, whether those
Sure.
messages are deterrence or whether those are let's mediate things between two gangs. And I'm just sort of curious, you went through a lot of data from former studies in Baltimore and other places, and now we have a changing landscape. And if someone says, okay, you got a MacArthur or whatever, some big award, Katerina, what does the new intervention look like with these changes that are going on with the structure of gangs, with younger involvement?
So if you stayed with focused deterrence, the custom notification, in Philadelphia, we have not had many call-in meetings. We've had 5 maybe over 4 years. Some communities have call-in meetings every 3 months. Chicago has call-in meetings outside of a formal setting. The majority of cities across the country do these meetings in a courthouse, and those individuals on probation and parole get a letter from a judge and says, as a condition of your probation and parole, you have to come in. What David Kennedy has really put forth as key in these custom notifications is you have to reach more people than are on probation and parole. And this goes to, I think this also speaks to these loose factions and unorganized groups, and being able to sit down with that intelligence. And again, this is where I believe you need research. When we showed that bar graph, okay, I've got it on animation. I should have just skipped it up. When we showed this graph with the names of the gang, here it's just gang 1 through 14. Our partners get this with the names of the gangs. They looked at the 3 gangs 1 through 3 and they were like, oh, this is probably why, they didn't change. We've been trying to give this data to them in real time. In Philadelphia, I would say we are not the ideal research partner the way you'd want to do it. Well, we wrote this grant so we would have a researcher embedded in the district attorney's office and working and being invited to every meeting and talking with them about what we're seeing. And even after we got the grant, part of it was the deputy commissioner of PPD retired, who was instrumental in this, retired right at the time we were analyzing the data. And we kept saying, we went to the new commissioner and the new deputy and said, look what, and the head of research and evaluation, look what we're finding. We should be talking about this. We had invited ourselves in to have a meeting with law enforcement all the time to say we should be talking about these gangs that didn't see an effect. The head of the gang task force took this and has now been saying, you know, gang one, this is what we need to do. The largest gang, this is what's happening. And they have decided that when they begin custom notifications, they're going to start with this gang. Well, they were dancing around the issue as we discussed last month, custom notifications, and I said, if you're going to do it, you should start with gang 1, 2, and 3. But I'm still the outsider. Even 3 years in as the researcher, I'm still the outsider here. And in a perfect world, that wouldn't happen. And I think in Chicago and Boston, there was much more fluid relationships among the researchers and the partners, where they were actually taking real-time data and going back and using it to improve their initiative. It's not happening. But I didn't fully answer your question. I think there's a way with gang intelligence embedding researchers in and working with community members, social services. It's not just go do the custom notification. You have to follow through. Here are the services we could offer you. In Philadelphia, our service structure was so siloed and so separate. Oh, you want to be a focused deterrence client to get services? You have to go through this implementation 6-week training session at RISE. Oh, and it's not available until December, and I'm talking to the client in September. This is what happened in Philadelphia. If you're doing services, you got to do it right. And I think with full implementation, but it's so tough, all the partners that have to be involved to make that happen.
Good afternoon. So I'm wondering, you started in 2012, correct?
Yes.
And you ended in 2014. So the climate has changed.
Yes, and
2014.
Philadelphia is still doing focused deterrence, but without the research support, basically.
So I'm just wondering what the numbers look like now in the PSAs opposed to what they look like in 2014.
So with the UCR numbers that came out and looking at shootings, shootings are up and homicides are up in Philadelphia and particularly in North Philly. And there's no outreach workers on the street and cure violence. In South Philly, they have not had a call in almost a year. The numbers are up a little bit too. Overall, if you were to look at a shooting trend line for Philadelphia, because South Philly was so big and North Philly, where cure violence was driving so much of the violence, there is a blip in those 2 years that both programs were fully implemented. Violence was pretty low, was probably at its lowest point. I truly believe that had to do with the two initiatives together. And now with the sort of diffusion of staff and not much going on in South Philly, and not having the outreach workers in the street, violence is climbing back up in Philly.
Gotcha. And this is more of a comment. I just think that we kind of focus on an individual after they turn 21 to 25 to 27, but we neglect to help the kid that's going through this, because it's already a norm by the time they get to 12. I just take something simple like crossing the street. In Baltimore, if you look at the way people cross the street, they cross the street the way their parents taught them.
Yeah.
They don't know how. It's a system in place, but they just don't know how to follow it. So I think that we need to focus on the kid, and I think that we could change the norm, but we just need that time. And I think everybody wants something to happen overnight, and it just won't happen this way.
Yeah. In Philadelphia, actually they hired a individual through the district attorney's office who was a formerly incarcerated individual to do prevention in South Philly. He comes to our focused task force meetings once a month. His main core task is to reach out to the communities and reach out to the younger youth. And it's a very novel, innovative piece, prevention piece, that the city is trying to expand in a way they believe, and I didn't write about that, it started later. It started 3/4 of the way into our evaluation period. But currently, the new inspector for South Philly truly believes exactly what you're saying. These younger kids, 9 through 13, they have biddy ball, the pre-basketball. They hold biddy ball tournaments all summer long and do these clinics throughout the year. And the gentleman who comes to these meetings, who runs outreach, has a community event every month, actually sometimes twice a month. On Saturday, he did a 2K walk with the community, and they got 50 kids to participate in the walk. So they're stamping, this is focused deterrence. We're caring about gun violence, but they're not necessarily talking about, they're just modeling the good behavior. So that's happening, and it's a shame that we couldn't measure that, and we don't know who those kids are. But what is fascinating to me, the woman who ran the gun violence task force in the district attorney's office resigned so she could open a nonprofit to manage these kids and do prevention, because she said through her experience she believes it's prevention. And hopefully at some point in Philly that will come back around, that our lessons learned will coalesce into a more comprehensive initiative. It's tough. Bigger cities, I did years and years of work in DC, and you got together with a group of researchers and city leaders and you said, we think you should do X, and honestly in the next year it often started. In Philadelphia, everything, it's really, really tough how big it is, and the politics of well, we understand what you're saying, but we also have to talk to Department of Health. We also have to do this. The political structure is so dense and immense that it makes it so difficult, I think, to say, hey, we got to add X, Y, and Z, and we might really have something here.
So first of all, I thought it was really very helpful. And thinking about the cities, I mean, you've talked about Philadelphia and being different within Philadelphia. There's some differences within Chicago. There's lots of differences within Baltimore. It seems like they're both what was just recently talked about in terms of having earlier interventions, because they're helpers, if not they're 3 years away from being the shooters, versus some of these other things. Are there some lessons learned about, instead of thinking about it at a city level, might there be certain neighborhoods or crimes or areas where one strategy or a combination of strategies might be more effective, and other things where it's less likely, and instead of thinking about it as city levels,
yes,
are there, I think you sort of alluded to some of these things when you talk about the differences. What are the things that really helped with
sure,
having reductions in large, I'm not sure what the numbers of people in the gangs, but it's a large number of gangs, and others where it wasn't effective? Or to some extent, you've also talked about there isn't a lot of evidence where we can get multiple agencies really working well effectively with each other, probably in most large cities. Are there sort of smaller whether it's geographic areas where things potentially could get pulled together?
I do believe that, and my comment is not going to be one that's very helpful. I'm going to say that a community that has an anchor institution, I spent a lot of time when I was at the Urban Institute studying why partnership initiatives work or don't work. And what I truly believe, and we looked at partnerships that started from the ground up, no federal money, started because a city agency wanted to. We had a variety of how did this partnership get going. And the ones that did the best and last the longest were the ones that started with a large, well-known community nonprofit that had a lot of pull in the community. Now that's just this is what I've learned. That's the easy takeaway from what I've learned over time studying that. I truly believe that residents working with community institutions, if there's a community institution, I'm meaning nonprofit, a nonprofit that has the will to write grants. A lot of what is needed, unfortunately, is resources to do something better, or to hire a jobs person, is anyone in the room working in communities to do something to buoy the capacity of your nonprofits. I probably spend 10% of my academic time working with community agencies on how to collect data. And luckily, and I like working at a university now because I have a model for a database for new community institutions. How do you collect data? How do you think about success? So when the grant comes along, the grant opportunity, you're ready and someone is ready to help support. That might not be the answer you wanted, but being able, you still, in my mind, you still need partners, and it might be an academic partner, it might be a couple community agencies, a stronger one getting with a smaller one that have a common goal in mind, but I think you do, in many ways, you need funding, but there's a lot of funding out there, and sometimes it's just under a different umbrella. Now it's trauma-informed care. And the work and the money available from VOCA and OVC in that area, if you frame the Philadelphia ceasefire program, is morphing into a hospital-based model, because that's where the funding is, and that's, in this case, that's where the city is also interested in. But being able to have the capacity to work for community agencies to expand their capacity.
Question. I think we have to probably go. You were aware of any of the studies that focus deterrence that look at how or if arrest levels changed in those areas? When you just sort of, you do your comparisons of strengths and weaknesses between these two models, and you note the not small cost of mounting a cure violence, and then you say, well, focused deterrence, you can sort of do this with existing resources. If there's a lot more people being arrested and incarcerated, of course, somebody is bearing those costs, right? So
Yes.
in our own focused deterrence strategy most recently, it was noteworthy to me how many arrests went up connected to that initiative. So I'm curious, do you know of any data on that question?
The only one who looked at the inputs and the arrests was, can you see that it's number 9, Project Safe Neighborhoods, Andrew Papachristos.
Okay.
Their long journal article in the Law Journal.
Yeah, I'm familiar.
They were the only one out of 24 that tried to dissect what happened in terms of activities. That's not fully answering your question, but I think they might actually have a count on how many people were arrested. They might not have, like in Philadelphia,
yeah.
We couldn't get incarceration data. Our judge sits on our task force, and we said, we know who's arrested, but we need to know how long they're off the street. And he said, I've been a judge for 40 years, and you're never going to get that information. It just doesn't exist. Someday we'll have it, right? So we couldn't even when we asked the court for it, they're like, it would take us 100 years to get you the time off the street by individual.
Wow. Okay.
So
I think we're going to have to wrap up now. Thank you so much,
Sure.
Dan.